Nova is the new third-party administrator for the medical plan. Nova will handle the customer service aspect, any claims processing, and pre-certification. Nova Healthcare Administrators is headquartered in Buffalo, New York. They have been servicing clients for more than 40 years and have an award-winning customer service team as well as clinical team. Preventative services are covered at 100%. Here is a top 10 list of some free preventive services that members can get, including routine adult checkups or screenings for heart disease, colon cancer, diabetes, high blood pressure, breast cancer, women's wellness visit, pap smear, and vaccinations for the flu or pneumonia, and any other vaccines that are preventative, in addition to annual doctor visits for children. There are some services which medical necessity needs to be established before they will be covered. Here is a list of the services that require a pre-certification: inpatient alcohol and substance abuse, chemotherapy, medically necessary cosmetic surgeries, dental services relating to accident or congenital disease and anomaly, durable medical equipment over $500, dialysis, gastric bypass, home health care, hospice care, any inpatient hospitalization, injectable medications, inpatient mental health services, outpatient surgeries excluding office-based settings, prosthetics and appliances over $500, and skilled nursing facilities. The company has two plans, which are the base plan and the buy-up plan. This slide is an overview of the base plan. Note there are no plan design changes. The deductible is $5,500 per individual, $12,000 per family. Preventative services are covered at 100%. Inpatient services, the deductible applies first, and then services are covered at 100%. Office visits, whether it's primary care specialist, chiropractor, physical therapy, occupational therapy, speech, emergency room, urgent care, all services the deductible applies first and then services are covered at 100%. In the buy-up plan, the individual deductible is $4,000 and $9,000 per family. Maximum out-of-pocket for individuals $7,500 and families is $14,000. Preventative services are covered at 100%. The deductible does not apply to primary, specialty care office visits, labs and radiology are flat dollar amount copays. All other services the deductible applies, then are covered at 60% after the deductible is met. This slide shows what the ID cards look like. On the top of the card is the Nova customer service number, where members and providers can call for claims issues, insurance verification, pre-authorization, etc. On the left will be the name of the plan, the group number, the member's name is listed next, followed by the member ID numbers, which will start with an A and then a series of numbers. The ID suffix will signify the member relation to the employee. The employee is 00, then any dependents will start with 01 and proceed for how many dependents are covered on the plan. On the right side are the 6 degrees and the prime logos, and information about the Open Access Health Plan, which doesn't restrict members' access based on a network. The deductible will be displayed depending on which plan the member is enrolled in, as well as the maximum out-of-pocket expense. On the back of the card is the address where claims are to be submitted, which is Nova. It includes a P.O. box, or they can be submitted electronically through Payer ID. Under the utilization header is where providers are going to look to see information on pre-certification and the contact number, which is the same number on the front of the card. In addition, the contact information for the 24-hour nurse helpline is listed, which will be reviewed later in this presentation. And on the bottom of the card is the pharmacy information. The RX provider will remain Magellan. The group number and the BIN and PCN are listed along with Magellan's phone number. This slide is an example of what an EOB, explanation of benefits, looks like. It will have the member's name and claim number listed, then it will provide the services that were provided. The EOB is generated by Nova. Nova will apply the specifications of the plan that the member is enrolled in to the services that were provided, meaning the deductible, copay, and coinsurance. On the EOB, the patient's responsibility, in other words, how much the member is responsible for paying, will be shown. Members should keep this document for their files and use it to compare to the provider bills that are received for services. In this example, the patient responsibility is $18, which is their coinsurance listed on line 1. If a bill is sent by the provider for more than $18, the member needs to contact Nova immediately so that they can work toward resolving the issue. Remember, do not pay a bill before it is compared to the EOB. If there are any questions, contact Nova first. The plan is moving from the Cigna network to a reference-based pricing program through 6 Degrees. There will be no more network. All payments are based on Medicare allowable amounts. If a member is having any issues with balance billing, facilities requesting payments upfront, or providers or facilities not recognizing your health plan, call Nova immediately with the number on the top of the card. There is a customer service department which will be able to help with all of these issues. Nova will be the first point of contact for any issue that you have. The company is happy to announce that as of July 1st, the plan will include a Teladoc. A Teladoc visit will be at no cost to members. Teladoc is a telemedicine service that connects members with medical experts in a variety of fields. To use the Teladoc services, members can access by phone, website, or app. This slide shows the steps on how to download the app and get it set up. The app is available through the App Store or Google Play Store. Once it's downloaded, the member will need to enter in some basic information and then create an account with the email address and phone number, username, and password. Members can also call the 1-800-835-2363 or Teladoc, or you can go to teladoc.com. Once an account is created, members can request a visit. Visits are available 24/7. The callback time is roughly about 10 minutes for Teladoc. Teladoc will respond with a board-certified doctor or pediatrician who's licensed in the state that the member is calling from. The doctor will review the member profile before they contact the member. Teladoc providers are able to prescribe medication. If the issue the member is having requires medication, such as an antibiotic, they'll submit it to the member's pharmacy. Most medications prescribed are generics. Members can request that their Teladoc provider consults with the member's primary care physician to coordinate care. Frequently asked questions for Teladoc. Teladoc is available 24/7 throughout the United States. Teladoc can be used for any non-emergency healthcare issues. Teladoc does not replace a primary care doctor, but should be used when it's not convenient to get to the doctor or outside the regular office hours. Or if a member is having an issue such as sinus problems, allergies, or flu-like symptoms. There's no limit of time to the talk and there's no extra charge, depending on how long a call lasts. It's all going to be the same price to the plan, and free for any members on there. Can my family use Teladoc services? Any covered dependent over the age of 18 would have to call for themselves. Anyone under the age of 18, the primary account holder, would be the one who would request the visit either through the app on the phone or website. The Teladoc doctors are U.S. board-certified internalist family medicine pediatricians. They average about 20 years of experience and are licensed to practice in the member's state. The nice thing about Teladoc is it is available in every state, so if you're traveling long distances, as you're in the United States, Teladoc is available for you. Nova offers a nurse helpline which assists members recognizing symptoms, finding doctors or hospitals, to manage a health condition, and exploring treatment options. If a member is on medication and not sure what the side effects are, they can call the nurse helpline for assistance. The nurses also proactively reach out to members for various situations, such as if the member has been recently in the hospital or received a diagnosis, they will call out to members to see if they need any help. If a member is having an upcoming inpatient procedure, to help the member understand exactly what's going to happen with that procedure and what they can expect from the procedure and when they get home. So just so everyone knows, if you receive a call from somebody saying they're registered nurse from Nova, it's not a scam. Deciding on choosing the right care can be confusing. This slide outlines the level of care available to participants and corresponding cost. The 24-hour nurse helpline is a free service that can help members with tasks such as recognizing symptoms, finding providers, exploring treatment options, and managing health conditions. Teladoc is available to members at no charge. This is for virtual doctor's office visits to treat non-emergency situations such as allergies, bronchitis, flu symptoms, nasal congestion, pink eye, and sinus issues or UTI. Teladocs are able to prescribe medication if needed. Primary care physicians is a member's principal provider for their health and coordinating care with other providers. Urgent care is for urgent medical situations that are too great for a Teladoc visit or unable to wait for a primary care appointment. Services an urgent care provider can do include, but are not limited to, minor broken bones, mild asthma attacks, routine infections, or first aid such as small cuts or burns. The cost is greater than a primary care visit, but less than an emergency room visit. And then the last step up in price is an emergency room visit, which is for emergency situations that need to be tended to immediately, including but not limited to chest pain, heavy or uncontrollable bleeding, large open wounds, trouble breathing, major burns, spinal injuries, severe head injuries, loss of consciousness, and severe abdominal pain. Nova does have a website and an app. Members do have to sign up on the website first. Go to novahealthcare.com and click on Member at the top of the page and complete the wizard profile to set up the account. Once a member has an online account, they can then download the Nova app on the App Store or Google Store. On the app, members can get a copy of their ID card, request more ID cards, and find the providers in the Medi-V site link, or see any claims and also the EOB. The only payment a member should pay at time of service would be the flat dollar amount for a copay in the buy-up plan. If a provider wants a member to pay anything else upfront, tell them that it has to run through the insurance first. If they insist, then call Nova immediately and have the provider speak to a Nova member representative. If a provider states that they don't recognize Nova, call Nova and have them speak to the provider and explain the coverage and benefit. If the provider still has issue with it, Nova will then reach out to 6 Degrees to continue the conversation and negotiate terms if needed. Nova Member Services is open 8 a.m. to 8 p.m. Eastern Standard Time, Monday through Friday. Note from the company: an important point to understand is that when the group plan is part of a big box network like Cigna, we had absolutely no control over what the provider was going to be paid. If Cigna had a deal with a provider for 5 times the Medicare allowable, then that bill is going to be 500% higher, and therefore the patient share, the deductible portion, would also be 500% higher than the same paid claim under our new plan. With the new plan, we're going to use the Medicare allowable cost as the reference that we are willing to pay. The goal here is to reduce the costs for the employees. This portion of the presentation is to focus how 6 Degrees works alongside Nova, what you can expect from the 6 Degrees team, and some of the aspects that might be different with this plan around access issues or balance billing, and what members need to know and who to contact. The first point of contact regarding any of the benefit matters should be Nova. Then Nova will reach out to 6 Degrees when needed. 6 Degrees is responsible for repricing the medical claims, to assist with issues from providers, and to make sure that things are running smoothly if there are things that need to be resolved. The 6 Degrees team handles provider negotiations and member communication. Prior to the July 1st implementation, there is a transition of care link that was sent out via email and through TraumaSoft and ESO. If a member has any appointments or procedures scheduled on or after July 1st, or if they have an ongoing care journey, they should go to that link to put their information in. This will allow 6 Degrees to proactively reach out to the providers to start communication regarding the new plan and work to minimize disruption in that care. Then 6 Degrees will also contact the member directly, letting them know the outcome of the provider conversation. Things like, was access secured? Does an agreement need to be put in place, or does 6 Degrees need to do any follow-up? The items that they really want to focus on during this time are members who have scheduled procedures, if there are any maternity cases, or if anybody has a chronic illness that they are receiving specialized treatments for. This slide demonstrates the flow of how the claims process will work between 6 Degrees and Nova. Members will receive care from their provider. That provider will send the claim over to Nova. Nova will make sure that claim and eligibility are verified, then send it over to 6 Degrees. 6 Degrees will then reprice that claim at that percentage of Medicare and send it back to Nova for processing. Nova will then submit the payment to the provider and send an EOB over to the member. What additional support does 6 Degrees offer? Because the plan is moving away from a traditional network that is very easily identified, when a member goes to a provider's office, they won't see a familiar network logo like Cigna. Many providers need to be educated on what an open access network is. Under this plan, members do have access any provider, but in the off chance that the provider does not recognize this new logo, or does not understand what an open access is, or tells you that they don't accept that plan, that's what is classified as an access issue. If you experience this, call Nova right away. If 6 Degrees needs to get involved, Nova passes the case over to 6 Degrees. The Nova number is on the ID card, so members are able to reach out to them directly. The sooner they get that information, the sooner Nova and 6 Degrees can step in to assist with access issues. Access issues most often occur because the front desk person doesn't always understand, and it is often just about educating them. If it goes beyond that, 6 Degrees works with the providers and facilities to come to a solution, such as a single case agreement. If that is not possible, it is at that point 6 Degrees provides alternative providers that work with the plan. Once the 6 Degrees team has that case, 2 things are going to occur. The first step is going to be 6 Degrees is going to reach out to the members to let them know exactly what they can expect and who they can contact on our patient support team. That will be within 24 business hours of receiving that case. Then 6 Degrees is also going to reach out to the provider and start working on any negotiations that might need to be had. They will supply the provider with additional education, or see what the provider needs help with understanding if that education is not enough. That's when 6 Degrees is going to work to put in a single case agreement in place. And what that single case agreement will do is it be a contract with that provider for that member. To make sure that member gets seen, and that there won't be any additional access issue, the 6 Degrees provider team can work on to put an agreement in place. And then 6 Degrees will communicate that update to the member. If the provider will not accept the plan, 6 Degrees will then work alongside Nova and the member to find an alternative provider. There are some providers that do not want to accept anything they could classify as out-of-network plans, or anything that's not a traditional big box network. And so, in that off chance, 6 Degrees can work to find a friendly provider of the same quality in that area. The 6 Degrees team will provide the member with the contact information for the team member who is going to assist you with the case, so you will know exactly who you can reach out to, and exactly how to reach out to them. They will also make sure that they get any information that they might need from the members, such as the best form of communication, or maybe best hours to call, etc. And then 6 Degrees will collaborate with a healthcare provider. 6 Degrees will engage Nova if needed, as well as your employer if there are many signatures for our agreements or anything that needs to be signed off on at a higher level. And then during that process, 6 Degrees will provide updates to the member directly as that case is being worked on. In addition to access issues, 6 Degrees also assists when balance billing occurs. Balance billing is when a provider is asking a member to pay the difference between that plan allowable and what they've charged for those medical services. If a member's patient responsibility was only $18, but the provider is charging the member $60, please don't pay that extra amount. In situations like this, contact Nova right away. They will contact 6 Degrees when needed. Because 6 Degrees renegotiated the payment, the provider accepts that renegotiated price as their billed amount. However, some providers attempt to recoup the difference, but once they accept a renegotiated price, that is not allowed, and the bill is considered paid in full once the claim is processed. The 6 Degrees team will step in and communicate this fact to the provider until it is resolved. The biggest thing that we need to make sure members do is open their mail. Make sure that you are opening your EOB and you're looking at the patient responsibility. And if you do receive any bill from the provider, you are checking that against that EOB. Anytime you are unsure, contact Nova. They're going to be able to confirm, is it a balanced bill? Is it actual patient responsibility? And once they confirm either, or that's when Nova would either send that case over to 6 Degrees, or they would make sure that members understand what the patient responsibility is and have you pay that as well. When it comes to balance billing, again, once a case gets submitted to 6 Degrees, our patient support team will reach out to that member, let them know what they can expect. They will again get the information for the 6 Degrees team member who will be handling the claim, and that will be the member's point of contact for the life of that case. Both Nova and 6 Degrees have online portals with supporting apps. The Nova Healthcare website or app will show members their claims, co-pays, deductibles, coinsurance, EOB, etc. It will also have a link to the 6 Degrees website or app, MediV. The MediV website allows members to perform a provider search. It will allow members to search within the area, and you can search for a provider that is either contracted through 6 Degrees or their partner Prime Network, or you can look for additional information about the provider. There is a color coding system that tells members if the provider is friendly to the plan or perhaps not. The providers in green are the recommended providers which may have a contract with 6 Degrees or the Prime Network. The gray providers simply mean that 6 Degrees does not have enough information on that provider to determine if the provider is friendly to the plan. The yellow and red coded providers are the ones that have demonstrated access issues or balance billing previously. This app will answer the following questions for members. Is this provider not recommended? Am I going to have any potential issues seeking care from this provider? MediV will allow members to search based on a zip code, and then within that zip code you can look at distance and you can narrow down to specialty. In addition, you can narrow down access just to look at contracted providers. Members will have access to MediV starting July 1, 2024. What does the network look like for Pennsylvania, Maryland, and Delaware? There are a lot of providers that are contracted in the area under the Prime Network. But again, it's an open access plan, so members can seek care from any provider of their choice. If a member wants to avoid a potential access issue or balance bill, then they definitely can seek care from a contracted provider. Side note from the company's point of view, regarding providers targeting members for balance billing. The company does thousands of trips every week between the two companies. We bill private patients 3% total of the time, so 3% of our revenue is private pay. We're lucky if we're able to collect half of what is billed to private at the end of the day. And every month when we do our write-offs, we write off bills for all kinds of reasons, but the bulk of the write-offs that we do wind up coming from private pay, that we know we're never going to collect. And in our case, over the 8 years that the CFO has been here, that's amounted to $3 million of write-offs of private pay. And this is being put out there because it is firmly believed that our experience as a provider is typical of all medical providers in general. They're not there to bill individuals for their service. They're there to bill insurance companies. We are paying them a very fair rate for their service. Anything else that they try to bill a patient is basically extra money that they're trying to get. In their heart of hearts, it is believed that they know that they're very unlikely to get, and therefore they're going to be very unlikely to bill it. So, this is being shared so that you are aware of the perspective from our own company as a provider. The cards will be sent out between the week of June 10th to June 17th. With the cards, there will be additional instructions in regard to a new member enrollment kit. This kit will walk you through those different portals and apps that are available through Nova and 6 Degrees. In addition to the resources at Nova and 6 Degrees, the company is going to hire a point person to be the liaison between the members, the providers, Nova, and 6 Degrees. We believe that this person will help deal with all of these issues and be able to make closer connections between Nova and 6 Degrees, the providers, and also educate our employees to sort out this brave new world that we're headed into. Remember, what the company is trying to accomplish by implementing this structure is to lower the spend by cutting out the middleman, i.e., the big box network insurance companies. The way this will be done is to pay providers a reasonable, transparent rate, while not hiding the actual cost in an inflated premium dictated by the big box insurance companies. The aim is to enhance our employees' healthcare experience while ensuring sustainable costs for both the company and our valued team members. Managing costs isn't about saving money by reducing care. It's about spending it wisely and ensuring the most appropriate care. To recap some of the highlights we went over today. One is that we are adding the Teladoc service, and that service is free for members. So instead of having to pay either towards their deductible or their copay for a primary care physician visit for the things that mentioned earlier, they can utilize that service for free, which is a bonus for employees and their covered family members. The other thing to remember is to not automatically pay a bill, and never pay anything besides a copay up front. If a bill is received, send it automatically to Nova, so Nova can speak to it and make sure either 6 Degrees is engaged or inform the member that it is their responsibility to pay. Lastly, we will be adding a person who will be the go-to person for all of our employees in regard to their medical coverage. So that person will be the point person for any questions they have in regard to the medical plan. When we have identified the correct person, their information will be shared with everyone. Thank you for your attention to this presentation. Remember, the company is here to support you through this change. If you have any questions or need assistance in understanding, please reach out to your HR representative.